Great. Good evening, everyone, and welcome to the semi-finals of Indian Debating League. I am Devika Khanna, and I will be moderating this round. Now, let me introduce you to the educator of the day, that is Himanshi Vadva from LSR. So, Himanshi ma'am is a renowned name in international debating circuits as well as in India. More than that, we have her here as she's one of the top educator consistently in major circuits like UIDO BPD 2021, Uhuru World BPD 2022. And she has also been the invited educator and grand finals chair of ICFAI APD 2022. And yes, debater, she has won some of the most prestigious tournaments like grand finalist of the Clash of Middle Earth BPD 2021 and Link Bay Debating Championship BPD 2022. Thank you so much, ma'am, for joining us today. So we have Team Maharashtra and Delhi from grade 7 to 9 today for the match. And the motion of this round is, this house will not provide public health care to people who do not take preventive measures to keep themselves safe. Bracket open, substances abuse, comma, obesity, etc. Bracket close. Now, quickly explaining why the motion is important. So public health care is often thought of as a right, but rights come with responsibility. The fund allocation to the health sector this year was INR 83,000 crore, which is just 0.33% of India's GDP. The population of the country, on the other hand, is humongous. This indicates limited beds and doctor per person, which give birth to the need of prioritizing certain patients over others. One way is to avoid the people who themselves get into medical trouble due to their lifestyle. Is this the right way? Question. Now the speeches are going to be for 5 minutes and the reply speech is going to be for 2 minutes. Speakers may ask POI and there will be no POIs in the first and last minute of the speech. All right, moving on to some ground rules. So I request all the debaters to please turn on their camera while they're debating and maintain that throughout the debate because you are being assessed on the manner. All right. Also remember, you have to keep your camera open throughout the debate. For timekeeping, your educator is going to guide you. She is going to be sharing the screen on which the timer is going to be visible to you all. You would be getting 15 seconds to wrap up your argument. Any argument presented beyond the time would not be entertained. And always remember, do not exceed the time limit. All right. On that note, I would now handle the room to Himanshi ma'am. All the very best debaters. All the best. Ma'am, all yours.
Hi everybody. I welcome you all to semi-finals of this tournament. Congratulations for making it up to here and all the very best for the upcoming rounds. I'll be sharing the stopwatch on the screen. I hope that's fine for everybody. Just give me a moment. I hope my screen is clearly visible. Without any further ado, I invite the Prime Minister to start their case. Here.
I will start in the reverse count of 3, 2, 1. An ounce of prevention is worth a pound of cure, said Benjamin Franklin. And we are here to tell how our healthcare system can benefit from enforcing this widely accepted fact. Good evening, respected adjudicator and worthy opponents. Today's debate's motion is that this House will not provide public health care to those whose lifestyle and voluntary decisions shape their diseases. Firstly, you may be wondering, isn't healthcare a universal right of all human beings? Let's make this clear. The case where the government does not offer treatment to someone will be reduced to a very, very, very rare and an extreme possibility through our solution. Our solution is to reduce the number of health problems altogether by bringing preventive healthcare into the limelight. Preventive healthcare will be an integral part of our healthcare policy. Our motion is to establish more healthcare checkups and diagnostic centers in schools, offices, rural areas, and keep track of healthcare records. If a patient visits a doctor for treatment, the doctor will check using proven diagnostic tests and health history if they have been coming for regular checkups and have been following health advice and offer treatment based on it. Several apps such as Arogya Setu are already being used today for tracking citizens' health, and this can be expanded upon and made more comprehensive to promote preventive healthcare. Yes, the proposition has considered the fact that there will be cases where someone is seeking urgent medical attention and it is shown from their records that they have not been taking any preventive measures. Well, what will we do in that case? In such cases, the government has to act strictly. Medical attention will be given, but on a chargeable basis. Suitable payment plans and loans will be mutually discussed. Sometimes hard decisions must be made for a greater good. The crucial stakeholders of this motion are the Government of India, citizens seeking healthcare, public healthcare providers, and our motion will benefit all of them, as we will see. We have 5 arguments. First, prevention of diseases is a cost-effective healthcare strategy compared to treatment. Second, make citizens more responsible for their health by spreading awareness, thus improving their long-term health. The third is an increased focus on preventive healthcare that will improve the Indian economy. The fourth is achieving a decrease in the number of people who are unable to get treatment from public healthcare. The fifth argument is the unfair use of taxpayers' money. The first argument is as follows. Prevention of diseases is a cost-effective strategy compared to treatment. According to the World Health Organization, 80% of all diseases are non-communicable lifestyle diseases, specifically in India. Reducing this large number due to our solution of encouraging preventive healthcare will allow more beds for people whose diseases can't be prevented easily. By focusing on ensuring preventive healthcare, Government of India will end up saving more because diseases requiring expensive treatments will be prevented. Thus, the health budget can be more effectively used on a wider population who are in more need of treatment and whose diseases cannot be prevented. This budget can also be used by scientists and medical experts to find better, improved cures for diseases like cancer. The second argument is as follows. Making citizens more responsible for their health by spreading awareness, thus improving their long-term health. If records say that a patient has not followed requirements like regular checkups, they will strictly not be given treatment by government, and instead they would have to seek more expensive private healthcare. The chance of such situations will be minimized, and we will elaborate on that later. The increased expense will help make the patient realize the importance of preventive healthcare and following a healthier lifestyle. Isn't that better for everyone? No one would want to experience like a painful and expensive treatment again, right? The third argument is the improvement of the Indian economy. Encouraging preventive healthcare of citizens leads to reduction in sick days, healthy mothers, healthier students, more productive workforce, thus improving the economy and revenue of India as a nation. The fourth argument is a decrease in the number of people unable to get treatment from public healthcare. I'm sure this is a normal sight seen during COVID, right? Waiting rooms filled with patients seeking treatment is a common sight in government hospitals. Increased focus on preventive healthcare will lead to less patients coming in for treatments. Thus, availability of beds for more patients whose diseases were not preventable will be available. The fifth argument is the unfair use of taxpayers' money. My second speaker, Aditya, will elaborate more on that. Thus, our motion clearly benefits all of the stakeholders, considering all aspects of public healthcare system. Thank you.
I thank the speaker for their fine speech, inviting the leader of opposition. Here.
So before starting, I'd like to clarify that I'll be taking POIs verbally, and I'll start on the count of 3, 2, 1. Health of the people is the health of the nation. Health for all must be the fundamental goal of all nations. The opposition team stands strongly against the motion. In my speech, I will be providing a model, rebuttals, and 3 arguments. We on the opposition side of the house would like to stick with the status quo. We will provide healthcare and disease treatment to every single citizen of our country. Like stated already, India only spends 0.33% of its GDP on healthcare versus USA, who spends a whopping 19%. As India changes from a developing country to a developed country, this number needs to go up. Also, to clarify, the money allotted to public healthcare includes money used to spread awareness of prevention measures. To reduce the demand of public healthcare, we will also increase awareness of prevention measures like the proper sanitation and diet. The stakeholders in this debate are people who do not take preventive measures, people who do take preventive measures, and the government. Our burden today is to prove to the panel why on our side of the house, we're able to minimize casualties from treatable diseases. Now on to rebuttals. The first speaker said that the proposition would increase preventive healthcare. All the points stating regarding this were already in place, and all people who avail this still require public healthcare. The proposition has not directly related that speech to the motion and has in no way stated why we need only provide public healthcare for only people taking prevention measures. The first speaker also stated that most diseases are non-communicable, but 53% of deaths are caused by communicable diseases in India. This is a wrong fact, proving why preventive healthcare is not always successful. To prove why we must provide public healthcare to everyone instead of being selective, we have 5 arguments. A, lack of awareness and funds to take preventive measures. B, why being selective is not the way out. C, it's impossible to identify if a person has taken preventive measures or not. The other 2 points, D, we must treat unavoidable diseases, and E, the right to life, are there in my second speaker's speech. My first point, in India, over 20% of the population is illiterate and almost 30% is below the poverty line. Yes, I'll take your POI now.
How can you say that preventive health measures can't be identified when most of these are actually regular checkups with doctors, diagnostics, body tests? How are those not identifiable and how can't we keep track of them?
So this is exactly what my second point and third point is related on. So I won't be answering that now. This causes a couple of problems. To actually take prevention measures against diseases, you need to know what are those prevention measures, and you need the resources to take those measures. Since a big chunk of our population can't do either of the things, does this mean that the proposition house is going to straight up not provide healthcare for these people? Is this in any way morally correct? It's not in the hands of these people to be able to prevent diseases. So why should they be the ones to face the burden of possibly losing their life? By providing healthcare education and public healthcare for all, we're able to save more lives, which is the ultimate aim of this debate. No, thank you. This point directly relates to my second point. Imagine a rickshaw pusher during Diwali. The AQI levels are extremely high, but he must still go do his job to support his family. He needs to be out there to earn money for his family. This man is aware of the harms of pollution, but doesn't have the money to buy a mask or air purifiers and gets lung cancer. Was it this poor man's fault? Could he have in any way taken preventive measures to stop this from happening? Another reason we can't be selective, since over 50% of the deaths in our country happen due to communicable diseases. So if we don't treat someone when we have the capability to, then that disease will spread manyfold. Again, showing that being selective goes against the aim of this debate. And finally, my last argument, which also connects to the POI. The proposition team intends to only give public healthcare to people who take preventive measures to stay safe. This policy will not work I would like to ask the proposition how they're going to track a person if a person has taken preventive measures and also to what level. Another problem arises with this policy. What about a fast response treatment, such as illnesses which require the patient to be treated immediately? No, thank you. Patients who have only minutes to live. Does the proposition intend to ask the person if he washed his hands properly or if he maintained proper cholesterol levels? In his or her last dying breaths, it is the basic duty of any doctor to save a person from dying, no matter his or her acts. To conclude, on the opposition side of the house, all the stakeholders are benefiting. The right to live is the most fundamental right stated in our constitution and is unique to only the opposition. Our case is simple. We provide public health care for all. We save lives, not money.
Educator, could I please
I thank the speaker for the fine speech, inviting the DPM. Were you saying something?
Yes, could I please have a minute?
Cool. Speaker, you may start.
Yes, I will be starting on the reverse count of 3, 2, 1. Every right implies a responsibility, every opportunity, an obligation, every possession, a duty. This was a famous quote said by John D. Rockefeller. Good evening, House. I'm the DPM, and I would like to bring to your notice that the opposition has failed to understand the situation at hand. Moving on to the opposition statements, they said the right to life is a basic right stated in the Constitution, but the will to stay alive is a basic instinct. Naturally, taking all possible efforts to stay healthy should be a natural urge. Staying healthy requires various preventive measures, and since the aspiration to stay alive is natural, then taking preventive steps to preserve our health should be a fundamental responsibility of every person. If a person is not fulfilling his or her fundamental responsibility, then how can they expect the state to provide for the failure? The state is not denying medical support to the people who fall ill even after all the precautions, who become victim of some freak accident. On the contrary, the state will provide the best possible healthcare facilities to such people. But for the people who are irresponsible towards their health needs and who are willingly violating the basic provisions of preventive measure, it is all legal and appropriate for the state to deny any health facilities. We agree that if a person is on a deathbed, we will provide them measures. We are talking about diseases which are long-term diseases. The people who are not concerned about their health and who consciously breach the principles of prevention should not become a liability for the state. And the already scarce resources should be only spent on the people who, even after all the precautions and preventions, become prey to the illness. Preventive measures are not just keeping a healthy lifestyle, but also backing yourself up financially. Such examples can be taken from insurance. The government has done everything they can to provide insurance for people of all economic stratas. In a meager 20 rupees per annum, a person can get an insurance coverage of 2 lakhs. That is substantial enough, but people are not aware. We never said by doing this, we are trying to save money. The only thing we're trying to do here is save lives which matter the most. And secondly, use the money to make people aware so that these diseases are not created in the first place. Now, I shall move on to strengthen my PM's arguments. First, the last argument. Taxpayers' money needs to be well spent. It's a collective pool. Is it fair that this be frittered away on drug addicts, alcoholics, and chain smokers suffering from conditions that are directly resulting from their habits? At the end of the day, the resource pool is limited. In the theory, it is fair that is spent on those who do not bring the illness upon themselves. If a patient gets cancer due to habituation to tobacco, the act of commission has been done by the patient. Nobody forced the patient to get addicted to it. No addiction should be covered by healthcare agencies, as it's akin to attempting suicide knowingly. In spite of government agencies educating people that smoking causes cancer, and yet the patient knowingly takes up smoking, he should not be compensated. Globally, any insurance companies charge an additional premium for smokers in principle. This is because they're committing the act of commission. We live in a capitalist world. Insurance companies charge higher premiums to those who are smokers, etc. It's a simple math at play. If you put yourself at risk, you pay for it. Similarly, if the state is going to take the responsibility of healthcare, it is fair for it to use its first rupee on those who didn't bring this upon themselves. The prevention of disease is a cost-effective healthcare strategy compared to treatment. There are 3 types of prevention that have been formulated, and it has to be followed by the people. If you don't follow traffic rules, you pay a fine. If you don't follow health advice, you have to pay for your actions. Every action has an equal and opposite reaction. Every act of commission by a person should invite an equal and opposite reaction from the government. The primary prevention, the intervention before health effects occur. Then there is secondary prevention, the screening to identify diseases during the early phases. And the last one is the tertiary prevention, managing diseases after the diagnosis. The primary prevention completely responsible on a patient. The government is already spending resources for that. Secondary prevention, the government can hold a health camp. It is the responsibility of a people to attend and get themselves examined and tested. And the main thing is that the tertiary prevention stage should be avoided as much as possible. The question is of balancing resource allocation to make healthcare available for all at the best time and place. All expenses from primary prevention are lower and for tertiary prevention are very high. So better to tackle as the primary and secondary prevention itself, so that the same budgetary provision can benefit many more people. But if a person needs help in his dying moments, the government will never shun him away. They will help him. We are talking about diseases in the primary and the secondary prevention stage, not in the tertiary stage. And with that, I conclude my speech. Thank you.
I thank the speaker for their fine speech, inviting Deputy Leader of Opposition. Here.
Uh, I should be starting in 3, 2, 1. A wise woman once said, human rights are not a privilege conferred by government. They are every human being's entitlement by virtue of his humanity. And with that thought, good morning to the House at large. My name is Samya Jayachandran, and I am the second speaker of the opposition. It would have been my duty to start with my constructives, but the shortcomings in the proposition speeches have forced me to start with my rebuttals. Speaker ma'am, what if a poor woman comes to the hospital for treatment of a baby which has a cold? If the infant has not had any checkups, will you reject the child? Also, what if someone catches a cold because they forgot to wear a mask once and then they are denied treatment because they do not trust regular treatment? Not denying treatment might cause a simple cold to escalate to something major, which has the following side effects. One, it causes loss of human resources. Two, people are punished for one small error. There should always be a second chance, and people who suffer due to carelessness are likely to take more measures in the future. Proposition, please don't forget that we live in a poor country. In fact, rural population in India was reported at 64.61 in 2021. Where will these rural people get access to clinics for regular checkups? In fact,
POI.
I would reject it. In fact, the total population of the Maharashtra state is around 54.78%, and I would now like to present my constructives in 4 sections. Firstly, new diseases. In the case of a pandemic where no one is educated to take measures, you can't not provide healthcare for them. For example, the COVID-19 pandemic, when COVID first came into our lives, no one knew how to take precautions. People thought eating pumpkin leaves would cure COVID. This ignorance resulted in 20.1 lakh deaths in India alone. Who knows how many more would have died if the proposition's policy had been implemented? One does not simply just get a disease on purpose. Now
Yeah.
tell me, if a man has been living his entire life without a mask, will he wear a mask just because you tell him to? No, he will take time to adjust to the rules. There will be slip-ups, and there were slip-ups, because in the end, we are all human, and it's human to make mistakes. Secondly, people who don't take precautions will be weaker than the ones who do. Hence, they need more healthcare. If these people are rejected, this becomes, like my first speaker said, a violation to the right to life. And if my opponents do know the right to life means that nobody, including the government, can try to end your life. It also means that the government should take appropriate measures to safeguard life by making laws to protect you. Thirdly, diseases, for example, congenital diseases, cancer, and etc., which can be avoided through preventive measures, need to be treated. Is the proposition implying that their hospitals would reject cancer patients or a hemophilia patient? Also, in some cases, the person cannot be blamed. For example,
POI.
what if a person stands on a bridge and they get hurt when the bridge falls? Should the person be blamed for walking on a bridge? How are they supposed to take preventive measures for this? For another example, children who have weak lungs are prone to develop asthma in the polluted environment of the NCR region. They go to school, play sports, or do go outside the house. Now, if due to the pollution they get seriously ill, they may even die. With the proposition's policy, they will obviously be rejected at the hospital. Proposition, is this what you want? Lastly, I would like to bring up the point that how will the proposition implement this policy? How will they track a person if they have taken measures or not? If the proposition will track a person's vaccinations, that's fine, but preventive measures go beyond vaccinations. The preventive measures can be simply drinking water regularly, eating healthy food, or even more. How will they monitor that? How shall they do that for 139.334 crore people. Even if they manage to do that, monitoring people every day is an upright breach of privacy. And I would like to add that this will be an Olympian task which requires large amounts of funding. Yes, what's that, POI?
Yes. So
Protected minute, no POI.
sorry.
Okay. I would now like to end my speech by quoting Jeff Lattis. Having universal healthcare will definitely save everyone. And with that, I would like to end my case.
I thank the speaker for their fine speech, inviting the government's reply speaker here.
Yes, just give me a second, please. Yes, I just like to confirm if I'm audible and visible.
Yes, you are.
Okay, so I'll start in 3, 2, 1. Let me summarize the opposition's case. All they have said throughout is proposition is completely wrong. Their model is completely bad, but they have failed to provide us what they would do. They say they're defending the status quo, and then they say that they're benefiting more people. But the entire reason this debate is there is because more people are not being benefited. Very few people actually go to private healthcare hospitals or even public healthcare hospitals. Okay, so before I move on to comparing the worlds on both the sides of the house, let me talk about the three main clashes in this debate. The first clash is opposition has failed to understand the importance and the definition, the basic definition of preventive healthcare. I even asked the POI to the first speaker about the matter. They say that a certain amount of the government funds is already going to preventive healthcare, and then they say that preventive healthcare is not important. How exactly is that? How exactly are you then defending the status quo? Your statements are contradictory to your opposition. Then they move on to say that preventive healthcare, and I quote, is if a person once forgot to wear masks, wash hands, and and a thing like a baby has a cold. You need to understand that these are not preventive health care. These are not the things that come under preventive health care. Preventive health care is not wearing a mask. It's like, for example, once a person is over 40 years of age, they are recommended to go to yearly body care, to go to yearly body checks, to go to yearly blood test routines. That is preventive healthcare. Preventive healthcare is not
POI.
wearing a mask. That is just basic information. I'll take that POI later. Then moving on to the next point that they said, washing hands. That's once again that's basic hygiene. That is not preventive healthcare. Preventive healthcare, as I explained, is much different than that. And then they fail to understand the importance of preventive healthcare as a whole. They say that preventive healthcare is not important at all and it will not do anything. But preventive healthcare is actually really important. They said a person having cancer, if a person having cancer is diagnosed in the first stage, that is preventive healthcare, because then we'll be able to treat it more easily. But if that is
POI.
diagnosed in the third, I will take it later. If that's diagnosed in the third stage, it's difficult to cure it there. And the amount that will go into that can be used for other resources. That brings me to my second clash, the impact on patients. The impact on patients here is that on proposition side, we are actually ensuring that they have a healthy lifestyle. Okay, let me tell you this. Let's say India has about, this is actually correct, there are about 20% people who are upper middle class and rich. And only these people actually have preventive healthcare measures. The other 80% of the population does not take any healthcare measures, and that is the current status quo. So the opposition world continues with that. People still do not do blood tests, and the situation continues, and people are still ignorant about their health. On our side of the house, this 80% of the population mostly rely on public healthcare. So we are forcing them to take preventive healthcare measures so that they get access to such public healthcare. Let's say 50% people out of that 60 to 80% say that we are not going to listen, and we want to continue with our life. We are not going to take any preventive healthcare measures. At least 30% of the population is taking preventive healthcare measures. At least 30% of the population is more healthier, and the amount of resources that would go to that population can be used for the other number of people, the other 50% who are not ready to do preventive healthcare. They say that we are talking, the opposition says that they benefit people more and not they don't care about the money. But on us, we are benefiting people more by conserving resources. This way, we're using resources in a much better way. Yes, I'd like to take that POI now.
So throughout your speech, you've been talking about how preventive measures is actually diagnostic tests, but sanitation and a proper diet is also preventive measures, since in a diagnostic test, you only get to know about a disease once it's already
I
happened.
get the question. Thank you for that. So, as I said, you're actually increasing my point. Thank you for that. Sanitation, a good diet, that is once again good lifestyle. That is not healthcare measures. You need to understand that healthcare and lifestyle, they're two different things. Okay, you can't say that a person eating a lot of sugar in their diet, that is not preventive healthcare. You could actually say that a person coming for regular sugar tests, regular diabetes tests, that is preventive healthcare. Okay, with that, I'd like to move on to the third clash, our model. There have been many questions about the propositions model throughout the debate. Summarizing our model, we are saying that, for example, if a person, as the second speaker said, if they're standing on the bridge and the bridge fell, that is an immediate accident and no person could have done anything to prevent that. So that is not considered in preventive healthcare measures. So that will be, those people will be provided medical care, those people will be provided free medical care in public hospitals. But if you're saying that a person who has diabetes, for diabetes doesn't come in one day, that person has a diabetes for the past 2-3 years, and then that person is coming to public healthcare offices in the last stage, we will not be ready to provide that person health care. Okay, because we want people who have actually taken care of that health, and this will be a lesson to the other population to take care of their health. We want a healthier world, not just where people are, not just where the status quo continues, where people are still dying because nothing is solved on the opposition side. We agree that we're not the best, but we're at least saving 30% more people. Thank you.
I thank the speaker for their fine speech. I invite the opposition whip. Here.
Okay, I'll start from the reverse count of three. 3, 2, 1. People that put themselves above others will fall longer and harder. Gina Lindley. A most pleasant evening to the House at large. I'd like to start with my rebuttals. The first speaker said that we could reduce the number of diseases altogether for more prevention. How can we prevent certain diseases like COVID-19, cancer, etc.? If a doctor is working in a hospital and gets a contaminable disease due to exposure, will you not treat him just because he didn't take the proper preventative measures and does not deserve treatment? Is this how we treat the so-called heroes of the 21st century? What sort of ironic metaphor are we living in? The first speaker stated that certain apps are already tracking us, like Arogya Setu, etc. Might I just remind you that the example that you gave, Arogya Setu, is not something that is invading the privacy of the citizen or being forced on them of their own free will. Furthermore, Arogya Setu only lets you know if you're in the proximity of a sick person. It doesn't put your life in the hands of the unworthy hands of the proposition. The first speaker stated that someone will obviously have to pay. Wow, so you're saying that the glamorous rich who have money and exposure deserve to survive and thrive, and those who don't have exposure, money, or resources can be trampled underfoot? Wow. Finally, one of your points actually shocked me and left me speechless. Mr. Judicator, is this the ideology that we should run the world with? The first speaker said that we should take tough action. Yes, tough action. Stop being stingy, trying to save money on taxes, being corrupt, and put human lives over a few bucks. No, thank you. The first speaker said that we should increase focus and investment of time, money, etc. Yes, we should. If you think there isn't space in hospitals, concentrate this money, time, and your resources on building more hospitals, more government hospitals, helping people, not running around trying to prevent a disease which cannot, in fact, be prevented. The first speaker stated that we should help those in need. Yes, those in need are the people who line up at government hospitals daily because they or their friends and family are sick. They do not have the money to go to private hospitals, and instead of shunning them merely due to their lack of resources and awareness, maybe we should cure them. And in your and in your words, help those in need. The first speaker stated that if people don't take care of their health, then government hospitals won't help. You heavily contradicted your first speaker who said that no matter how severe the disease is, we will help. I mean, if you're going to say something, at least discuss it with your team first. The first speaker stated that increased focus on prevention will lead to less students coming. Yes, less patients are going to come, but you know why? Because they can't afford it, because they don't have the exposure. They're going to go to private hospitals, take taxes which will ruin their lives. No, thank you. Take taxes which will ruin their lives, all because we put the rich above the poor. The second speaker said staying alive is a natural urge and everyone should try. Staying alive is a natural urge. But when you see a baby eating a pen cap, for example, or a 13-year-old eating a pen cap, what are your reactions? For the 13-year-old, you think the 13-year-old is being sheerly dumb and stupid, while the baby is being sheerly dumb and stupid, while the baby is innocent. This clearly represents poor and rich. Poor people do not have awareness, resources, education, or access to anything to know that. No, thank you. To know what they're doing is wrong. Maybe we should focus all of this money towards spreading awareness, towards spreading knowledge about these topics, instead of using it on, oh, we should prevent diseases that can't be prevented. The second speaker stated that taxpayers' money should be used efficiently. Yes, taxpayers' money should be used for the benefit of those taxpayers, not in your pocket. The second speaker stated that no one forces anyone to smoke. Let me remind you of this really glorious thing we have in the 21st century called peer pressure. There's such a thing as that. Children fall for peer pressure because of their classmates. They can be forced to smoke. How do you know? Maybe there is a problem at home. Maybe they have an unstable house life. Maybe they have a mental disease. How can you blame a child for something that is completely out of their control? No, thank you. Here, I'd like to end my speech by saying that the opposition shall rise while the proposition shall fall.
I thank the speaker for their fine speech. With this, we come to the end of constructive part of the debate. Inviting reply speaker from opposition whenever you're ready. Here.
In 3, 2, 1. There are three main clashes in today's debate. The first clash is on the right to life. This right is unique to the opposition. The prop tried to salvage this point by saying that there's a will to stay alive, and that is a responsibility to every citizen. But they failed to address our first point, that there are people in India who aren't literate and don't have the funds to take prevention measures. So it is these people's responsibilities, but it is also the government's duty to provide the person with the means to at least stay alive. This shows why the right to life is only upheld on our side of the house. The proposition also failed to address our point on the COVID-19 pandemic and how they intend to track and record of preventive measures taken by people. The next clash is on what is a preventive measure actually. I would like to inform the proposition to kindly go to all government and health websites and see what a preventive measure is. A preventive measure literally means to stop the illness before and not to cure it. Taking a test will only tell you about your illness after it has already happened to you. The third clash is on which side of the house do patients best benefit.
Why?
The opposition obviously wins this clash since we are providing universal healthcare, which will effectively save more people. By the way, there's no POIs in reply speeches. To conclude, we have stated 5 arguments. A lack of awareness and funds to take preventive measures. B, why being selective is definitely not the way out. C, it's almost impossible to identify if the person has taken preventive measures or not. D, why we must treat unavoidable diseases. And E, the right to life, which proves why the opposition should stand. To reiterate what I said in the beginning, on the opposition side of the house, all the stakeholders are benefiting. The right to live is the most fundamental right stated in our constitution and is unique to only the opposition. Our case is simple. We provide public health care for all. We save lives, not money. Thank you.
I thank the speaker for their fine speech. Inviting Gov reply speaker to end the debate. Here.
Could I just have some little more time?
Yeah, cool.
Yeah, I'm ready. 3, 2, 1, go. Proposition has clearly won this debate, as all the crucial stakeholders will be positively impacted only in our side of the debate. Also, opposition has never clearly rebutted any of our arguments properly. The opposition has just been poking holes in the argument, and they have not had any solid counter argument or policy for this. First of all, let me look at how all the stakeholders are getting benefited. The government of India, it's happy. Economy improves, healthier workforce, healthier students, and lesser sick leave, more productive work days. Citizens seeking healthcare are happy. Overall health and well-being of citizens improve as they become more responsible for their health. Public healthcare doctors are happy since burden and stress of providing emergency treatment is reduced as there are lesser number of patients and preventive healthcare is less stressful than emergency treatments. Scientists and other medical experts are happy. They will get more budget to focus on finding and improving cures for more important complex diseases like cancer. Opposition has failed to convincingly rebut the following arguments and has failed to properly understand the definition. On opposition side, there's no increase in the Indian economy, and the budget that's allocated for healthcare is just being blindly used. There's no decrease in the number of people who are unable to get treatment from public healthcare, and still only limited people are given healthcare. Leader of opposition talked about how auto wala has got lung cancer due to pollution. Well, let me reiterate the definition. Did the auto wala knowingly get lung cancer? Was it due to his voluntary action, or was it due to external reasons like pollution? Our health checkpoints will use diagnostic checks that show problems in vital points and will act accordingly. Cancer, cold, and pregnancy are not preventable diseases. Opposition has to understand. Like my third speaker said, opposition has to understand this and has given clearly the wrong definition. They have failed to convincingly explain how long-term health benefits for people if preventive care is not given importance. We said that we'll expand on Arogya Setu. This improves my point actually, because even now more startups can try to improve this app for the betterment of the country. The taxpayers' money will now be used for a better purpose. Don't you think this will really put the taxpayers' money, like they'll make them more relief? Thus, proposition has clearly won the debate. Opposition is far off. Opposition did not give proper arguments, rebuttals, and it failed to understand the simple definitions of this motion. Thank you.
I thank the speaker for their fine reply. With this, we come to the end of the debate. I once again thank all the speakers for their wonderful speeches. I'll take more than a couple of minutes, a little more than that, and then be back up with the verdict. Thank you.
All right, can everyone turn on the cameras, please? And I know everyone is excited and nervous to hear the verdict, but why don't you guys tell me about how your experience was?
It was fun actually. The other team, it was a fiery debate. It was full of POIs and
Interesting. What does anyone else have to share their experience? How was it like? Did you guys enjoy it? I could sense every one of you are nervous right now, waiting to hear the final verdict and who's going to make it into the finals. But yeah, okay, Samya, why don't you tell me how your experience was?
It was nice. I'm
All right.
basically just happy that I didn't have to do my homework.
Oh, you got lucky then, I'll say. All right, Varnika, why don't you go ahead?
So I actually agree with, I think, like the third speaker of the opposition. There were many POIs, and the debate was good on both the sides. It was extremely argumentative in a way, like it was a really tense debate. And I think that's partly because of the motion, but the debate was really good overall.
Great to hear that. Okay, I see Arav complimenting everyone that it was a great match. Arav, why don't you share your experience?
Ma'am, I think the experience was fantastic, and this is just going to help me proceed in my career of debating, and it's just going to help me build more interest and experience, and it's just another learning opportunity, I think.
Great. Right? And yeah, of course, we wish all our debaters all the best, and it's just a part of the game. One party loses, one party wins, but most important thing is to gather the learnings and gather the experience you go, and then prosper on that and build your further journey onto it. Great. Okay, so I do see Sudarshan and Aditya waiting for sharing their experiences, so why don't you guys go ahead?
Yeah, actually, like the whole debate was very argumentative. Like it was amazing. Everyone was like charged up to like 120%, and I'm sure that everyone's heart is beating like really fast right now. So
I
it's gonna
feel
take
that.
some. It was an amazing debate with you guys. Everyone spoke really well.
Yeah, I do see a lot of appreciation coming in the chat box, and someone is complimenting on the enthusiasm, someone is complimenting on the POIs. Great to see and hear you guys. And okay, Aditya, why don't you go ahead and share?
The debate was really interesting and enlightening. It was really fun how each person matched each other and pushed each other to go higher in the debate and how they thought on the spot. So it was a really great learning experience. And Team Delhi was really amazing. They totally brought up points I didn't think about.
Wonderful. I think it was a great debate, and I could not disagree more with you guys. Agree more with you guys. And I think we have Himanshi ma'am ready with the verdict. So why don't we just give the floor all to her? Himanshi ma'am, please go ahead.
All right. Hi everybody. I hope my voice is not feeble or unclear.
Yeah, it's perfectly fine, ma'am. Yeah, please go ahead.
Cool. I'll just set up my timer and start. So I congratulate both the teams for what was a very fruitful and engaging debate. But regardless, we know it's only one team that can proceed further, but that doesn't mean that the team didn't do well. It just means strategically or comparatively, there were certain things that could be improved, right? Regardless, both the teams did amazing. So I'll start with general feedback, and towards the end, we'll move towards the verdict. Cool. What do I get from both the teams? I think side government tells me that preventive measures basically look like regular checkup, diagnostics, etc. And since you have a track record of these, you can track whether or not a person has been taking preventive measures. Secondarily, the benefits of the policy they are advancing that they come and give about are one, cost effectiveness of this policy, given that now you have sufficient beds for people who actually have more serious diseases that they didn't land themselves deliberately into, which means the state has to spend lesser money given that it's public institutions they were talking about. Secondarily, they also mean that since people are more likely to take care of themselves to prevent getting more charged for getting treated in private hospitals, they're going to take better care for themselves, which means long-term health benefits. Thirdly, Indian economy in general being better because people are more productive given that they're healthier. Fourthly, other people being able to get treatment. And fifthly, there's no unfair use of taxpayers' money. I think this in general, in brief, was the case of side government. What does side opposition tell me? Side opposition clarifies that preventive measures don't look like diagnostics. Even if diagnostics are one part, preventive measures look like more day-to-day things like sanitation, taking proper diet, etc. And there's no particular metric to judge whether or not a person has been taking preventive measures. Secondarily, they run the nature principle constructive, as in right to life, and states' duty to protect these lives of people, doctors' duties to protect these lives of people. Next, they talk about lesser awareness amongst people to actually be able to access preventive measures and take care of that. Yes. So how do then the debate pan out? I think here I agree with side opposition on their definition of what preventive measures look like. Like they tell me diagnostics happen after the disease has been caused. Like you get checked up that, okay, as a judge, I can understand regular checkups is something preventive that you can come to know about the disease happening. But that does not mean things like sanitation, things like taking proper diet, etc., are not preventive measures. And if these are preventive measures, if that's established by like the thought of average reasonable voter that I'm supposed to be, how exactly are you gauging these measures inside government then becomes the question, because this is after all a policy motion. I need clarity from inside government on how exactly then you gauge these intangible factors as well. I have clarity on how you gauge diagnostics, but how exactly are these things gauged does become important. I think then, since this is a policy motion and government has the higher burden to prove the effectiveness of their policy at the basic level, then unsure when you are unable to gauge how exactly or whether or not people are able to access these preventive facilities, how exactly then the model pan out. Apart from that, I think all the benefits that side government tries to like picture are spot on, but how exactly do these benefits come about when gauging is not clear? I think here modeling and the technicalities of model become very important. But yeah, like other people in general being more health driven and people who are not actually into people who are being diagnosed with more serious diseases, getting the beds, etc. I think those benefits still stand inside government. They have been credited. Whereas inside opposition, I think they run one point that I credited to them on how exactly is side government engaging these things, which then means that people who did not have these situations in their own hands, for example, you being poor and having to run the rickshaw, despite you know that the air quality is bad, or you not having the money to access more preventive things like air purifiers, etc., means that you are somehow denied cheaper public treatment as well, which also directly then goes against your right to life. So I think they are also able to push the constructive of right to life, even though it's everybody's fundamental right. Indian Constitution also accepts that. I think right to life is better prevented inside opposition that way, because even if a person deliberately did not take a preventive measure, even if that's something that happened not out of their own hands, at the end of the day, their life needs to be preserved. Secondarily, since they are the government actors in this motion, they're also talking about having to increase the overall spending, given that the government right now is spending less than other bigger countries you see around. But thirdly, they also talk about how there are many communicable diseases, and if you do not treat them, the people affected, like there can be more people affected by these untreated people with communicable diseases. I think side opposition could flesh that point more, but still I could get the implicit sense that how there are increased number of communicable diseases right now, which means a lot of people do need to be treated, whether or not they did that deliberately, and that constitutes around majority, but which also somehow means that transmission rates are higher, so you need to protect the entire population in general. But accepting side opposition could have like fleshed out this point furthermore. And lastly, they also talked about errors being possible, that even if some human error has occurred, they deserve like the right to be treated. However, the points that side opposition talks about, say, examples of bridge, etc., I think side government was right to point out that's not really a preventive measure in terms of healthcare. That's an accident where they are going to provide treatment at the end of the day. So with these things being on the side, how exactly then do I weigh this debate? I think principally a claim stands inside opposition that everybody has the right to life and that needs to be protected. But on a pragmatic level, I think side government had to provide proper model on to how to gauge these very intangible aspects of preventive healthcare, like sanitation, etc. I think the point you become dismissive that these things do not constitute preventive healthcare, you are just skewing the definition of the model, which somehow acts in the favor of the other side, who's contending that yes, this is also a definition. Then these poor people who cannot easily access the say resources to prevent and protect themselves from diseases are then worse off inside government, which means a more vulnerable group is worse off on government. And on the metric of vulnerability, I then feel that side opposition is able to protect vulnerable people as well. Though the benefits of long-term healthcare of people and more healthcare to other people stand, but for that, gauging the very like aspects of preventive measures had to be talked, but also in general, you on a metric of utility where more people's health is protected, I think side opposition takes it away from me. That's my verdict. Are there any questions from side government? Any questions? A yes or no could work so that we have clarity if team has questions. All right. Opposition, do you have any questions? Opposition, any questions? Yes, no. Yes. I saw somebody from Prop unmuting themselves.
Yes, I'm actually the third speaker from Proposition. Could we get some personal feedback?
Sure. You have to contact the organization on their email ID for personal feedback, and they'll get in touch with me. They'll communicate my response to you.
Thank you.
Thank you. So congratulations to opposition for advancing to finals, and side government. I think you guys also did great. Some things I can understand, this is a policy motion. Policy motions place a higher burden on the side government than the opposition. Regardless, all the best for future tournaments, and I hope you learned from this one. Thank you.
Thank you.
That's true.